Hi, my name is Monica Moore. I'm a registered dietitian and a master's candidate at the University of New England. My final capstone project is a systematic review titled Effects of Thiamine Supplementation on Lactate Levels and Mortality in Critically Ill Adults with Sepsis in the Hospital Setting. I'll go through an introduction, objective, methods, literature review and results, discussion, conclusions, and implications for practice. To start off, it's important to know what the different components of this review are. Those include thiamine and sepsis. Thiamine is a water-soluble vitamin, also known as B1. It can come from food or supplementation. The RDA, or recommended daily allowance, is 1 to 1.2 milligrams daily. Thiamine is stored in the liver, however, it's stored in very small amounts, making deficiency of this prevalent, especially in the critically ill or SIRS patients, which is systematic inflammatory response system. Some studies have found that up to 71.3% of participants were thiamine deficient at admission, which is a very large number. Other studies reviewed, which we'll talk about in a little bit, ranged anywhere from 10 to 29% deficiency at baseline. Additional studies have suggested that there is a 50% increase in mortality also associated with critically ill patients with thiamine depletion. Symptoms of deficiency can affect neurological issues and also can cause Korsakoff's syndrome and Wernicke's encephalopathy. Sepsis is an indicator of critical illness in hospitalized patients. It may lead to septic shock and is a common cause of mortality in critically ill adults. It's associated with elevated lactate levels, and guidelines for diagnosing sepsis were recently modified to include lactate over 2 millimoles per liter, lower than the previous threshold of 4 millimoles per liter. Other diagnostic criteria for sepsis include SIRS, which is the systematic inflammatory response system, fever, elevated heart rate or respiratory rate, elevated white blood cells, altered mental status, edema, hypotension, and vasopressor use. Elevated lactate levels, as previously discussed, were recently increased, but a significant increase in mortality was seen in the Surviving Sepsis Campaign database when over 2 millimoles per liter and as high as 44.5% in those with lactate greater than 4 millimoles per liter, which makes this sepsis mortality significant. The connection between thiamine and sepsis is that previous studies have looked at these two things and looked at the thiamine's effect on lactate, which, as we just discussed, elevated lactate is a sepsis indicator. Current trials running with vitamin C and thiamine combination therapy on serum lactate levels are looking at this, but thiamine supplementation even alone may possibly lower the lactate levels and thus sepsis mortality by increasing time to resolution and improving overall outcomes. This leads us to our objective of this research review: to evaluate the effects of 100 to 300 milligrams of IV thiamine on lactate levels and mortality in critically ill septic adults in the hospital. Inclusion criteria included age 18 years or older, hospitalized, a diagnosis of sepsis or septic shock, elevated lactate levels, critically ill diagnosis, and studies of various designs. Designs included in the review were randomized control trials, prospective studies, retrospective studies, and observational studies. No studies were included with less than 10 participants, and the range of publication years included was 2014 to present. However, a few positive graded studies from earlier were included. English was the chosen language for the articles. Exclusion criteria included being younger than 18 years old, non-hospitalized patients, those that had end-of-life goals or comfort measures only code status, and those with less than 10 participants overall were excluded. The studies that were still in process without results or not written in English were also excluded from this review. Doing a database search, I looked at PubMed, Biomed Central, and other clinical trial registration sites for current research and information. Some of the keywords used were sepsis, thiamine supplementation, critical illness, lactate, thiamine, and hyperlactatemia. Using that database search and the Prisma flow diagram, I started with 130 articles that were identified through the database search, resulting in 117 articles to screen after duplicates were removed. 97 articles were excluded due to animal subjects, pediatrics, non-hospitalized, abstracts only, and other systematic reviews and case reports as their design. After the eligibility screening was complete, 18 articles remained and were evaluated in this systematic review. Of the 18 articles that were included, 7 were randomized controlled trials, 3 were prospective studies, 5 were retrospective studies, 2 were observational, 1 was therapeutic, and all studies that were included in this had an intervention of IV thiamine supplementation, whether it be solely or as a combined treatment, and an outcome of either serum lactate or mortality or both. Quality grading was done, and grades were assigned based on the Academy of Nutrition and Dietetics Evidence Analysis Library Quality Criteria Checklist Guidelines. Once performed, 15 of the articles in the review graded positive, 3 articles graded neutral, negative graded articles were excluded. Once I looked at the 18 articles, I performed a literature review, and I will summarize that now. The slides do have a lot of information on them, so I will not go through every single detail of every single article, but I think it is important to look at, if you have more time at a later time, to go through and do this, or take a look at the research matrix that I have included as well, because there's a lot of great details in these studies. The first article, Byerly et al., was done in 2020. It was a therapeutic retrospective design. It was used to evaluate the effect of vitamin C and thiamine as a combination therapy on mortality and lactate clearance in the ICU. 11,330 adults were used. The treatment group got vitamin C, thiamine, or both. The control group got no supplementation. The overall mortality was found to be 25.9%, and there was an association between vitamin C and or thiamine and mortality, and this was found to be significant with a p-value of less than 0.001. Zadaka et al. Had an article in 2019, which was a randomized controlled retrospective cohort study. The study used ascorbic acid, which is vitamin C, B1, which is thiamine, and steroids in septic shock patients to evaluate the effects on mortality. 62 adults were used. They received either 1.5 grams of vitamin C every 6 hours, 50 milligrams of hydrocortisone every 6 hours, and 200 milligrams of IV thiamine twice daily, versus the control group that received just the standard of care. And the intervention group with supplementation was found to have significantly lower ICU mortality and hospital mortality. In Willem et al., a retrospective single-center matched cohort study, they determined if critically ill patients with septic shock exposed to thiamine would see improved lactate clearance and outcomes. 1,049 adults were seen. The IV thiamine ranged from 100 to 500 milligrams in the treatment group. The control group had no thiamine supplementation and was done at a 2-to-1 match to the treatment group. Thiamine administration was found within 24 hours to be associated with improved lactate clearance and reduction in 28-day mortality. In Danino et al. In 2016, a randomized double-blind placebo-controlled trial, which is the gold standard for research design, determined if IV thiamine would reduce lactate in septic shock patients. Of the 88 adults that they looked at, they had half in the treatment group with IV thiamine of 200 milligrams twice daily in 50 milliliters of D5 over 7 days, and the other half in the placebo group with just IV D5 twice daily. No significant difference in lactate levels at 24 hours between thiamine and placebo were found. 48% of lactate change in thiamine group versus 20% in placebo group. So even though this was not significant, it is still a difference, and you do see that lactate change was greater in the thiamine group. Of a side note, 35% of the patients in this study were found to be thiamine deficient at admission. Hemming et al. Did a prospective observational study in 2020 assessing the relationship between thiamine lactate and clinical outcomes in septic patients. 28 adults participated. There was no treatment or placebo group since it was just an observational design, but they found no correlation between total thiamine and lactate concentration and no correlation between the different types of thiamine and lactate. The effect of thiamine and thiamine diphosphate, however, were lower in non-survivors versus survivors. In the Danino et al. 2010 study, a prospective observational study design as well, they determined the prevalence of thiamine deficiency in critically ill adults with sepsis and the association between thiamine levels and lactic acidosis. 30 adults participated, and they compared ICU admissions versus ER admissions as the control group. 10% of patients had thiamine deficiency at admission and another 10% after 72 hours. No correlation was found between lactic acidosis and thiamine. However, a positive correlation between thiamine and liver transaminases and lactic acidosis was seen, which could lead to a trend between thiamine and lactic acidosis. Casserly et al. In 2015 did an observational analysis to obtain serum lactate within 6 hours of admission for patients suspected of sepsis or septic shock. 28,150 adults were looked at, and 19,945 were included for lactate levels in this study. Lactate levels were marked at over 4 millimoles per liter. They also had to have signs of infection and sears. No treatment or placebo groups were used since it was just observational, but it did have a significantly higher mortality rate seen of 44.5% in patients with hypotension and lactate over 4 millimoles per liter, and a certain significant mortality increase with lactate over 2 millimoles per liter. Moskowitz et al. In 2017 used a randomized double-blind placebo-controlled trial to test if thiamine supplementation improves kidney injury during septic shock. 70 adults were included into the study. The treatment group received IV thiamine 200 milligrams and 50 milliliters D5 twice daily for 7 days. The placebo group just received the D5. More patients in the placebo group were started on renal replacement therapy, and worse creatinine levels were seen in the placebo group versus the thiamine group. Another Moskowitz et al. Study in 2014 was a prospective observational study looking at thiamine deficiency in DKA, which is diabetic ketoacidosis. 32 adults were included in this study. No treatment or placebo groups again, as it was just observational, but 25% of patients, interestingly, were found to be thiamine deficient at baseline. The median lactate levels in thiamine deficient and thiamine sufficient groups differed significantly, with a p-value of 0.006. And 50% of patients had lactate greater than 2.5 millimoles per liter. This showed a statistically significant inverse association between lactic acid and serum thiamine. Falder et al. In 2010 was an observational cohort study used to examine the levels of thiamine in burn patients, as well as effects of thiamine supplementation on the levels of serum thiamine, pyruvate, and lactate. 20 adults were included in this study. The thiamine treatment group got IV thiamine 100 to 200 milligrams. The control group got no thiamine. Significant association was found between thiamine supplementation and serum thiamine levels, with a p-value of less than 0.001, and a significant interaction between thiamine level and time was seen. An increase in serum thiamine was associated with a decreased lactate level. Specifically, 1 nanogram per milliliter increase in thiamine resulted in a decreased lactate of 0.016 nanomolar.